Wow.
And yeah, I mean, I can't, it was a very, it's very, it's a privilege to really do
Yeah.
this work, truly a privilege. Um, and yeah, go ahead
Yeah,
if you have
no,
a
I saw, a
question.
lot of the use cases, it almost quote unquote feels like we can put in a bucket of mental health, right? If we talk about addiction, existential crises, burnout, are there any, and not to say that those are not somatic diseases, right? Because we know those come with physical manifestations as well. Are there any uses for psilocybin as well for, any other type of, we say cardiovascular or GI distress, any other type of organ systems that we look at that are not typically associated with maybe childhood trauma and reality in the life we live and kind of the stresses that we put on ourselves?
Mm. I don't know the research or if we have any research regarding cardiovascular. Um, I had this case recently with who is a 60-year-old judge who has MS.
Hmm.
from
Right.
itself, you
Right.
know? And and he was like, you know what, 100%. It's like a hundred
Yeah.
percent. It is correlated, and most likely, we don't have the research to say it's caused by, but from all the things that I'm seeing, it feels that way. That's for
Yeah, there's
sure.
that great book, right? The Body Keeps the Score that I have not yet read, but it is on my
Hmm.
list, which talks about the physical manifestations and how closely linked our mental health is to our physical health. And so that is why I brought up the question. But this is even actually maybe more appropriate. Is you mentioned stuckness, right? And today I actually had a patient who had back pain, fusions in the back, has tried so many different medications, all the different types of therapies, stuck, right? Could not get his pain under control to the point where at our last follow up, we mentioned doing cognitive behavioral therapy with pain psychology. And him being a male, which I think played, a little bit of a factor into this, is no, I don't want to go see a psychologist. How is that going to change my pain? I've seen other people go through this pain psychologist. They said it hasn't helped. And so there's this disconnect between realizing that the pain you feel, causes the mental distress and you get into this negative feedback loop. And so now as we're having this conversation, our health systems across the United States don't exactly support using these psychedelics, in these situations or finding the right providers. But is that a case that you've seen over and over again where you have somebody with chronic pain and that they go through psilocybin and it actually reframes the way that they think about their own pain and actually can alleviate a lot of this? Because you did mention the neuroplasticity. So I was wondering to get to touch a little bit about that.
Like, no, no, no. They were not. This is, the psychological trauma is the same. It's body and mind and spirit. All of it is the same. So if you've had that kind of trauma, then it is going to manifest itself in your physical
Yeah,
form.
and it's funny, right? Talking about the stigma, right? The or probably a decade, and even now, a lot of people think that marijuana is quote unquote the gateway drug. And I always have to teach attendings, teach faculty, and teach other residents or medical students, whoever it might be, that actually it might be the gateway to the root cause of what you need to learn, right? It's a gateway to a reality that you have yet to live and understand. And so I'm wondering is before you have a client that's interested in psilocybin, how do you know that they're ready? What is the pre-work that you have to look at? Because I feel like there's a lot of people out there who might say, "Oh, I'm ready. I can go on this trip," and the next thing you know, they have a bad trip. They weren't ready for it. They went in arrogant rather than confident. And I've talked about this. I did a Temazcal ceremony in Tulum, Mexico, with my wife. There weren't any psychedelics involved, but we were in a blacked out igloo, beating drums. They create a sauna-like environment, and I thought I was probably the most spiritual person there. I thought I had it under control. Next thing you know, I'm almost having a panic attack saying, "Oh my God, this is not what I was expecting. I can't see anything." And so, how do you gauge whether somebody has that willingness to go into the uncertainty, if it's their first time to go through an experience like this?
Hmm. You know, the first thing is there's no from the outward, inside, you don't see a perfect time. It's that the individual feels this calling towards, okay? And then, for example, what I do, I screen my people very closely. We go through a whole screening process. There is a discovery call that happens. Let's see what you're about. Let me learn about you. You learn about me. You have to make sure that the guide you have is in harmony with who you are. And if they're not, then move on, go to somebody else. But a lot of people who are come from a traumatized, mindset, they're not very, very clear. So even that is part of the education I
Mm-hmm.
do with people. And we never go into a ceremony just like that. It is that there's pre work to be done. And if I see commitment to this work, then I can confidently say, fine, let's do the macrodose session. And then afterwards, we do integration
Mm-hmm.
together. So it's a whole container. It's not go to a retreat in South America and come out like a whole new person. It could be really ugly when you come back. You know what
Right.
I mean?
Right.
Because the support isn't there. And who knows, like, what happened there, what came up for
Yeah.
you, and things we hold on to, we're not aware that it's in the subconscious and then it becomes conscious. Oh my God. And if you don't have a guide who you trust in that moment to hold you and keep you safe, man, and in a very caring and loving way, it can be harmful.
It's funny you mentioned that. That was actually
um
my next question was, what can people expect in the difference of taking psilocybin when they do it self-administered versus going on a retreat versus having someone like you where it's guided, especially in terms of the downloads and then the afterwork that they need to do?
yeah, the difference is, psilocybin is one of those that no one suggests. Like, everybody who's got any expertise in the field does not suggest you do it by
Mm.
yourself, though there are people who do it by themselves. Now, if you are that person, I highly, highly, highly recommend, before you even consider macrodosing, go with the minimal dose. Like, minimal, minimal, minimal. You may not even feel it. It will be self-perceptive to go with a
Mm.
microdose, but you are just familiarizing yourself with the medicine, with the plant, this ancient teacher that's been around since the beginning of Earth, before humanity existed. So there's such sacredness and such wisdom in this plant that we have to honor that. And in honoring the plant, you honor yourself. So you start with very tiny doses. And if you feel like, yeah, I want to dabble in higher doses, um, you can do it by yourself. And there's some people in the community that do it, and that's fine. I'm just of more of a, psilocybin also opens up social connectivity. And so if you do it with a
I see.
guide, it's even sweeter, even
Yeah.
better, because it is going to open you and expand you. And when you do it with a guide in a macrodose session, um, if they know you well, which I not usually, 100% of the time, I know my people very well before going into a macrodose session, then I can anticipate what's going to come up for them because I've done this long enough now, I'm a decade in. And so, we do a lot of work beforehand. They have homework to do on these patterns that I see in them, they're carrying subconsciously. So I'm like this. It's so funny. I was thinking about this with a client the other day. It's like I'm the mushroom without taking the mushroom.
Yeah.
It's like, because I've done this for long enough to really see those patterns, and I'm
Right.
like, ooh, this is where we need to work. This is what we got to do in order to have the clarity that you're seeking through the journey. And so, yeah, when things come up, I do some somatic work during the session, and I get, I have individuals consent. I'm an osteopathic medical physician, and so manipulative medicine is something I'm
Hmm.
trained in. And just like you said, the body keeps score. There are certain places, like, it could be somebody's foot that I feel this draw to work on during a
Mm.
macrodose ceremony. And sure enough, there's a pressure point that needed a release, and here we go, there's a release. The individual starts crying, or they say something of significant meaning to them from you know clearing out what they need to clear out from their
Yeah.
subconscious. And so it's a journey that having a guide alongside you um, really helps significantly, with also not just during the journey, but also afterwards in
Yeah.
integration. Um, because I'm there with them the whole time. I take notes. I even record their voice, certain things that come up, and yeah, we work together afterwards
Yeah.
intensely to see what's come up for them and what's alive for them and what they need to work on in their life. Without that support system, there's a 10% chance of an adverse
Mm.
outcome. So if you're going into it, doing it by yourself, there is that 10% adverse outcome, including panic attacks, including psychosis. And yeah, those are the top two that can happen, part of that 10% adverse effect, if you don't do it in the proper container.
Got it. It's so I'm a DO as well, and honestly, osteopathic
Yay!
medicine is it's almost a lost art now. I mean, more and more academic centers are using it less and less. And even me being trained in physical medicine rehab, I mean, me and my co-residents or DOs try to keep it alive as much as possible for those that are interested. But it's tough to implement it, in our healthcare system because there's so many people that only want the quick 10 minutes, 15 minutes. But as you know, I mean, you're doing this through a journey. It takes time to release the fascia, find the Chapman's points, and find the pressure points that you need. So it's very cool to hear that you truly are integrating so many things, and also that are research backed, right? So that's awesome to hear, and has really got
Yeah.
me thinking about how to integrate my practice in the future. Yes.
Awesome.
Speaking on the side
Awesome.
effects, are there any medical conditions that if people have, they should definitely not be using psilocybin?
Great question. Yes, exclusion criteria in the research setting that we see are the diagnosis or history of schizophrenia, bipolar disorder, any history of psychosis, any history of manic episodes. Those individuals are excluded, and I'll get into that too. But and this is all in my
Hmm.
book, by the way, Darsh. Like, all
Yeah,
of the research
and
is in there regarding
we're
all
gonna
this,
link your show
all
note.
these
We're gonna
nuggets.
link your book into the show notes for sure. So audience can go there to definitely buy it. Yep.
Awesome. Yeah.
this is getting maybe philosophical, but I've got to ask, does that make you think, if it is more DMT in the CSF, that schizophrenia is truly a condition, or is it more of just a stigma that we're labeling, right? Or is it that we become schizophrenic if we are
Yeah.
taking ayahuasca, and that we're on the same quote unquote playing field as them?
Yeah. Yeah, I think the latter is, what rings more true, but this is a hypothesis.
Right.
This is not really based in
Sure.
science that we've seen. Um, but even schizophrenia and bipolar, when you really look deeply, you will find in these individuals very significant trauma in
Okay.
childhood. And so, if you dig deep, I don't know if you know Gabor Mate. Do you
Yes.
know
Yes.
Dr.
Yep.
Mate?
Garamata. Yep.
Awesome. The myth of
Hmm.
normal, right? And he talks about in his research significantly about where these psychiatric diagnoses came
Hmm.
from and why, and SSRIs, and that really the foundation of our understanding of psychiatry is based on
Right.
fallacies. And that when you truly look into all of them, I've spoken with psychiatrists like from Cornell to Harvard to everywhere, and they say, we need to like cross out DSM-5 and write out unexamined
Mm,
trauma. You
yeah.
know?
Absolutely. Yeah.
Now, that said, right? That said, with schizophrenia and bipolar, the things that have worked the best that I've seen in research and people who are doing this work is through embodied and somatic practices. So these individuals tend to they don't need psychedelics. They already got that. They need practices that engages them with the moment, with their bodies. So get them to working
Mm,
out, get them to dancing, get them to creating creative expression through writing, creative expression through painting, get them to be in community with others so that they are now here in the physical realm more than in the other realms. So and then nutrition. I don't know if you know about Dr. Chris
yes.
Palmer at
Yep.
Harvard, who is, yeah, he's doing the
With
ketogenic
mitochondria. Yeah.
diet on schizophrenia and bipolar.
Hmm.
Incredible work, like that's really where I see we need more research for that population. Again, I think it's really important to know that psychedelics are not for everybody. Everybody has their own formula. Everybody has a personalized path, and that's what I make sure that I reiterate and iterate again with my clients. Every individual has their own path. Are there commonalities regarding certain things that we carry with ourselves regarding trauma and our nervous system being imbalanced and things like that? Yes. But everyone's experience is different in life, and that has to be honored
Yeah.
as
No,
well.
for sure. Wow. Yeah. I feel like we can go down the rabbit hole for sure. So, um, I did, I did want to ask about physicians who are interested in getting certified in this. This is something that's becoming more new. I've definitely talked to physicians who have been medical marijuana providers, and they're saying, hey, that's old school. This is going to be the new school now. But you teach and you have a course. Who is it appropriate for? What type of physicians or coaches should come to you to look at getting certified in being a psilocybin aid?
My
Oh,
little
no
one is
worries.
here. Sina, do you want to come sit with me? Okay.
Yeah,
different day. But it's powerful stuff. It's powerful stuff if you do it within a community that cares, with guides that will support you. And for us physicians, like, it excites me so much that I get to do this work. I get to spend time with my patients and clients and make them better. Like, that's all we
for
want,
sure.
right? As
Yeah,
doctors, like, I just and we I didn't have these tools before, and my own challenges and my own traumas is what brought these tools forward, and had made me explore more, that there is more, that there are so many other tools that we can offer our clients and each other and ourselves in our path of self-discovery. So yeah, the certification program is very rewarding, and there's observerships, and then the individual physicians or therapists, they the second half of it, they run
mm,
groups, um, and then there's observerships. There's a paper they have to write, and to check off all the competencies of the program, and then they'll get their
very cool.
certification.
And we'll definitely link your website too, because that syllabus is very extensive. It looks amazing as I was going through, and I was like, I got to do this in the near future. So we'll definitely link that in the show notes for easy access. So it seems like you're already integrating these things into the health system, working with governments. How do we change minds? How do we break the stigma? How do we become more pervasive with this and get more and more people to accept it, especially when we integrate it with the health system?
Yeah, talking about it and really coming from an educated space. Don't perpetuate misinformation or information you haven't
Hmm.
checked with someone that knows about it. Or, over the years, I've been checking online, like Google once in a while, or I go on PubMed and I'm like, oh, there's so many studies. Go on PubMed, go on Google Scholar, and like check, like fact check to see, is this a real thing, or is this something that people made up and because of some stigmatized some information, or is it or reach out to me. I'm happy to answer any questions. I've been in this
Yeah.
in this realm for about a
Huh.
decade now, and so I've seen all of it, and I've seen when there was nothing to now there are like thousands of studies coming out. But yeah.
Yeah. Is there anything you're excited for? Is there any type of questions you want answered by the research? Where is the world of psychedelics and psilocybin heading?
Yeah, thank you for that. I would love to see more studies in the microdosing realm. There is, do you know Paul
Sounds
Stamets?
familiar. Is he part of MAPS? Pulse.
I think I'm sure he's done some
Okay.
work with maps. Rick
Yes.
Doblin is
Oh,
the
well.
one that created maps, and he was on
Yes,
my
I saw that on
podcast
your
actually
website. Yes.
recently. But oh yeah, yeah. So no, but Paul Stamets is the world's most famous
Oh, yes, mushrooms. Yes, yes,
mycologist.
yes. I've seen the documentary on
Um,
Netflix. Yes. Yes.
the
Yes.
mushroom guy with the
Yes.
hats, right? So he stars in the Fantastic
Yes.
Fungi.
That's what I saw.
Um,
So
Yeah, the
I
use.
know we're coming to a close here, but I've got to ask, do you feel like there is, maybe a higher purpose, or do you feel like there's a true purpose for why psilocybin has been put on this earth? For humans to try to explore reality
Hmm.
and the universe, and like, what does it mean to you? What do you take out of the psilocybin? If you know what I mean, what is the purpose of it being there?
Yeah, yeah. I really do believe that it is a tool for our evolution on every
Mm,
level, from spirituality to everything. I mean, everything else, comes from that. Um, and connection to ourselves, to be able to hear the whispers
love it.
within that for so long we block out, and now they're coming forward and they're like, hey, I'm here, listen
Yeah.
to me. And once we learn that, once we turn our heads that way and we say, I hear you and I listen to you, and I will go to where you're telling me to go, because that's where, the truth
Hmm.
is. But you have to clear out a lot of cobwebs to get
For sure.
there. And that's what psilocybin
Yeah.
does.
Amazing. Well, Dr. Lito, where can our listeners find you? What are the best resources that you have that they should go to learn more?
Awesome. My website is really the best. It's got all the information. It's drlidafatemi.com. I have a newsletter that comes out once in a while. I have a podcast that comes out bi-monthly. It's called The Conscious Physician Method, or The Conscious Physician Medicine and Psychedelics. I have a best-selling book that came out in February, and it's, I've had several speaking events for it, and it's really my program in a book, so that I could make it more affordable and accessible to communities at large. And so yeah, you can buy a signed copy off of my website, or you can get it on Amazon. And yeah, everything that we said and more stories and
Hmm.
more information is even in the book. So yeah, thank you so much for
Yeah,
having me
absolutely.
today,
Absolutely. No, I
George.
want to I
Yeah,
want to thank
yeah,
you for
yeah.
your passion and purpose, your teaching and education here. I mean, you can tell that you're truly passionate about this, and that rubs off. And I definitely want to get more into this space and learn about it, because, like you, I think there really is a deeper meaning, and I think we can really change the perceptions of how people choose to live in this world, especially as it gets crazier, and especially as we turn to external forces, artificial intelligence. We have an epidemic of loneliness, as well. So bringing back that social connection, bringing back servitude and gratefulness in humanity, I think is very important, that for physicians to speak about. So thank you for your time coming on to this podcast to educate the listeners as well. I do have one last question for you that we ask all our guests, and that is, how do we put the health back in healthcare?
Oh man, great question. Bring it back to yourself. It's all, we got to look at ourselves in the mirror, and that's how we can do it. Yeah.